Anxiety disorders. Anxiety disorders cause people to feel excessively frightened, distressed, and uneasy during situations in which most others would not experience these symptoms. Other symptoms can include racing pulse and heart, feel like a heart attack, chest pain, nausea and/or vomiting, trembling, shaking, muscle tension, shortness of breath, aggression, difficulty concentrating, difficulty sleeping, and the person may also avoid social groups and crowds. Panic disorder. Panic attacks are associated with this disease and can strike at any time. Afraid of having more attacks, they avoid public transit and shopping malls. Obsessive compulsive disorder. They have unwanted persistent thoughts, obsessions, and need to perform repetitive activities, compulsions. They can take over their lives. Post-traumatic stress disorder, following a life-threatening experience or one that caused physical or emotional harm. These could include rape, child abuse, war, natural disaster, or death. They can have flashbacks, nightmares, depression, or uncontrolled anger or irritability. Phobias has two categories, specific and social. Uncontrolled, irrational fear can be fear of an object, situation, animal, or activity. General anxiety disorder, repeated exaggerated worrying for more than 6 months. They have disappropriated levels of worry over routine events and activities, always expecting the worst and disasterizing. Program 1. Join a yoga class or online yoga video at home. Must last at least 15 to 20 minutes each time. Must do this 3 to 5 times a week for 1 month and track the days on a calendar. After the month, the client and programmer must revisit the benefits and assess if there were any changes in stress levels or personal thoughts towards stress reduction. If the client feels any benefits, the program can be adjusted as needed. If the client has not seen a benefit from the program, may be repeated or canceled and reassessed again. The client must also read why the yoga classes were suggested to reduce stress and anxiety and inform the programmer why they think it didn't help or why it did help. Program 2. Walking program. I would introduce a walking program to the client or patient to reduce anxiety and stress in everyday life. Client would be assigned 30 minutes per day, 3 to 5 days a week, inside or outside, depending on client's preference, and it can be independent or with a partner. Again, client's preference and accessibility. Client would be instructed to walk slow, not speed walk, and absorb the scenery or the path being taken, whether it be in a rural area or streets. If client is not fond of noise and traffic, it would be suggested to go to an area of calm and relaxing surroundings, or even a treadmill indoors is fine. Again, keep a journal of days walked and how the client feels each day before and after the walk. The program would be reassessed after 1 month of client being on the program, and also reassessed for the client's feelings towards the experience and if there was any benefits. Program 3. A journal or diary. On this program, I want the client or patient to keep a diary or journal of any fears, episodes of anxiety, or good feelings that they have and how they dealt with it, and to understand that this is a journal to keep and that no one else will be reviewing it, not even this programmer. The client will endeavor to fill it out every day for a month, and it may have more than 1 entry per day. It should include any stressful experiences, sad, happy, angry, or confused episodes, and how the client dealt and felt each time. At the end of each week, the client is expected to read the week's entries and learn from the experiences, reflect on how it could have been differently handled, and what the client can do if it happens again. If the client has a difficult time writing or thinking about what to write down, he or she could use point form or just jot down the main thoughts. After the month is complete, the client can discuss how the journal went, and if the client feels like talking about specific experiences, they can. Also, if the client or patient wants to continue with the diary, it is encouraged. Program 3, Part 2, Checklist. In this part of the program, I want the client or patient to write down a checklist of what they should do when they are feeling stressed or like they're going to have a panic attack. I want the list to include 1 or 2 contacts that they feel comfortable calling for help, family, friend, or even a web friend. It should be a person they feel safe sharing their disorder or issues with. So on this list, it should have in order who or what to do when the anxieties start and are mild. Then the following steps should be what to do if the situation or feelings get worse. For example, start with deep breathing exercises. Give it time though. Get away from everyone and find a room to be alone. Call mom just to talk and release anxieties. Call a friend or spouse. Take a hot bath and put music on. When all else fails, don't forget medication from the doctor, like Ativan. If all else fails, call a doctor or go to the emergency department. Program 4, Music Relief Program. In this program, I want the client or patient to find some music that they find will allow them to forget all else and just enjoy the music. It might be soft, easy listening music to help them relax and meditate, or it could be heavy metal music that allows them to dance hard and not think about anything but the music. Another type of music could be happy music, just any type of music that makes them feel happier listening to it, like 50s and 60s music, doo-wop kind of music. And some people enjoy classical music to feel like they are in another place and not thinking about their problems. I expect this person to choose a specific time of day for 3 to 5 times a week, or more if possible, and to play their chosen music for 30 to 60 minutes each day. It can be done during an activity like dishes or driving. This is also an activity that is not assessed after the month, but can be continued after the month ends, but can be discussed and continued if enjoyed.